It's not something as women we talk about often, excessive pain or irregularities when it's that time of the month.
It could be a sign of something more serious, a condition called endometriosis, which affects up to 10% of American women.
So how do you know if this affects you? Morning anchor and health reporter Kirsten O'Connor is standing by now to ask a doctor.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
Well, it's not always comfortable or easy to talk about menstrual cycles, but it's something all women have to deal with at some point, and for some, pain is a sign of something else going on. So I have Dr. Natasha Spencer with me, an OBGYN with Orlando Health Physician Associates. We're so glad you're here, and of course this is a topic that you're talking about a lot this week. It's Endometriosis Awareness Week, and so some people are just going to ask, what is that? They've never even heard of the condition. So can you give us a little explainer?
Sure. Basically, endometriosis is when the lining of the uterus implants abnormally in the abdomen of the pelvis, in pelvis of a female. And
so it's something that you wouldn't be able to see on someone, you know, just going and doing an exam. No. How do you get a diagnosis?
So for definitive diagnosis, you have to undergo surgery. We usually do a laparoscopy in order to find these lesions, biopsy them, and send it to pathology for confirmation.
Yeah, and that's kind of a difficult way to try and find out that you have a condition. When you talk to women about endometriosis, are they reluctant to undergo that type of surgery to even get the diagnosis?
Most people are. Most people are more willing to try medical or hormonal therapies prior to undergoing surgery, since it's not benign. It comes with risk.
And I know the only time I have heard of it is when I've been talking with people about fertility treatments, because endometriosis can affect your fertility.
Right. About 30 to 40% of women are subfertile who have endometriosis. And yeah, it can be a difficult thing to go through. Most people are diagnosed when they're undergoing fertility workup or therapies. Another big way we've diagnosed it is when we go in for doing incidental other surgeries or like tubal ligations.
And you were even talking about hysterectomies, different surgeries that women undergo, not knowing that they've had this condition their entire life.
Their entire life, right.
So what are some signs that maybe we need to be telling our daughters about earlier on, so that they can be aware that this is something that they could potentially have?
Well, some of the symptoms of endometriosis can be as specific as heavy, irregular menstrual cycles, pain with menstrual cycles, and painful sexual activity, but others can be very vague as far as bloating, nausea, vomiting, because it all depends on where the lesions are located in the areas of concern.
Yeah, and so, I mean, for women, a lot of times you come into the doctor, you have these annual exams, and you ask those questions. Are you experiencing any of this pain? And what do you hear from them? Probably no.
No. Yeah, I don't think women are as open as they need to be. A lot of women with endometriosis are living with debilitating pain. I think women focus a lot on others in their families instead of themselves. And so it's my goal is to have every woman open up to their OBGYN, so this can be a very common diagnosis where we have adequate treatment and we can change their lives.
What are some of the treatments, you know, when you do find out that this is something you're dealing with?
The most common hormonal therapies are combined oral contraception, progesterone-only pills. There are also some gonadotropin-releasing hormone analogs, and some newer, older drugs, but now we're trying to move it towards treatment for endometriosis, are things for fertility like letrozole or Femara.
And so there's hope on the horizon for people who are dealing with this. And it can be debilitating, so it's something that you should go and seek care for immediately.
You should, yeah, because there's treatment out there, and you do not have to live with debilitating pain and a poor quality of life.
All right, Dr. Spencer, thank you so much for talking with us about this important topic. We appreciate it.